Hey guys, I'm here to update you guys. I don't know if y'all went on to Kristen's YouTube channel. That's my intended mother, but we did a video together like 3 or 4 days ago. So if you haven't checked that out, go on to her channel. Her name's Intended Mother, and subscribe if you haven't already. But we did a video together right before our last doctor's appointment. So go check that out. It's really funny. And our kids were like being little terrors during that video. But definitely go and check that out. Okay, I just want to do a quick update and answer some questions and ask some questions too to any of the YouTube people out there who are watching this video who might can help me out. So first I'll start with the update. I'm 35 weeks pregnant with the twins. They are growing, they're healthy, and I had an appointment on Friday. And baby A is about 5 pounds 4 ounces, and baby B is about 5 pounds 8 ounces, which is really hard for me to believe. I mean, I feel big. I feel like there's 2 in there. I'm developing more symptoms week by week, but I don't know. It's really hard to believe they're 5 pounds. My boy was 7'13", and my girl was like 6'9". So this is 10 pounds of baby up in here. And I'm not used to that. all that baby, being all baby. So it was reassuring and awesome to hear how big they are, because I just feel like any day they could come and they'd be healthy babies. So praises on that. I have an appointment this Friday, which is in like 4 days, and we'll kind of take another peek at them and see how they're doing. The scheduled C-section date is going to be June 26th, which happens to be my husband, and it's our anniversary. But I'm like, I'm not waiting. That's like the first possible day that they'll do the C-section. I'm like, we're doing it that day, because I'm not waiting any longer. I'm already ready. So I'm like, oh well, be more reason to celebrate that day than just our anniversary. So that's the plan. I'm hoping they'll come sooner, but we'll just have to wait and see. Oh, symptoms. My legs are now swelling. It's not just my ankles and my feet, but it's now moving up all the way up my legs to about my knees. I'm hoping it won't keep moving up and up and up, because I don't want to blow up. But yeah, pretty much my legs, ankles, and feet have blown up. My newest symptom are that my newest symptom is that my hands fall asleep whenever at night, during the middle of the night. So about every 30 minutes I turn over from one side to the other, and for some reason they fall asleep. Doctor says that it's normal. It's because I'm having a little bit of swelling in my hands and in my wrists, and then I guess there's a nerve that's being compressed, and therefore my hands fall asleep. So she said that's fine. My blood pressure looks good, so she's not worried about the swelling. Pretty much all the symptoms have been exactly like with my other pregnancies. Actually, no, they haven't. Most of them have been up until the last month. Then I got swelling. Did not get swelling with my babies. And, of course, my hands didn't ever fall asleep. So, those are my symptoms. I'm trying to think of what else. Babies are literally, like, kicking me way up here. Like, especially when I'm sitting down, you know? So, like, babies are very, very cramped in there. And they really try to kick up on my like diaphragm right there, like trying to kick up and make more room, but for the most part I feel good, but I'm feeling very big. Anyway, okay, so I'm going to answer some questions that I got on my last video, which was at 32 weeks. One of the questions is, are you willing to pump or donate your breast milk? And my answer would be that, well, really, Kristen and I have never talked about it, and she's never expressed any interest, so I just assume she's not interested, And honestly, I'm ready to get back to my old life. So I'm not being selfish at all, because I am doing something so selfless for somebody else. But I feel like the whole year has been all about being a surrogate, about the babies, about Kristen and Rudy, about our journey. And I've really tried to stay focused on my family. But yeah, my husband's like verbalized that he's, like ready to have his wife back. And not that he hasn't had me, it's just the focus has been on the babies. So he's ready to for us to focus on our family more. And so I am ready, once this journey ends and once the babies are with Kristen and Rudy, I'm really ready to, recover and focus on my family. And so if I have to be pumping and donating the milk and making sure I'm pumping every so many hours, then, that's going to take more time away from my family. So I am choosing at this point not to pump, unless Kristen, verbalizes that to me in another way. Then I may give it a second thought. Okay, so then the next question someone asked me was about my weight gain. Basically, since the transfer, so since I became pregnant, I've gained 29 pounds. However, I did gain 10 pounds before the transfer, whenever I was on all the injections, the progesterone, the Lupron, the birth control, all of the cycle meds. I gained 10 pounds. So all in all, I count that towards my weight gain. So 39 pounds is what I've gained. I wanted to say thank you. There was someone that subscribed to me that mentioned Surrogate Moms Online, and I've really been using Surrogate Moms Online to find some of my answers to some of my questions. So thank you for that. Whoever mentioned that, thank you. And I guess that's all the questions that I'm going to answer right now. If you have any other questions, just comment below, and totally try to answer those for you. I wanted to talk to you guys about this Belly Bandit that I'm really excited about. But I have had 2 previous C-sections with my babies, with my kids, with my son and my daughter. They were both C-section, and the recovery is just, it's painful. And anyway, someone had suggested, or I've been hearing about this band that you put around your incision and around your belly. And I think mainly it's used for to get your belly back in shape, to reposition your muscles, to kind of remind your muscles where they need to be after you give birth. But also, a lot of C-section patients use it to kind of hold their incision tight. That way there's not a lot of jiggling going around, and it's less painful as you move around. And so I've been kind of researching this over the last 3 weeks, and I'm really excited about it because I didn't use one. And when I get up for the first time and walk after the surgery, it's not good. And so I'm really looking forward to having this belly band. I'm going to go try them on in the next few days. There's a store here that carries them, and they're called the Belly Bandits. So if y'all have any experience with those, let me know. And I will let y'all know if I end up getting one, which I think I am. Kristen, of course, is going to help me out with that. So they treat me so well, and anything I need, they provide it for me. So that's always a plus. Okay, the last thing is, what should I bring to the hospital as a surrogate? I don't know what to bring. I don't have to bring baby clothes. I don't have to bring baby supplies. So what do I need to bring as a surrogate? Because I don't really know what I need to bring besides, pajamas and stuff for me. Okay, quick belly shot before I go, because I gotta go. I have 20 seconds. Okay, here's a 35-week belly. Belly, belly, belly. There it is. It's big. It's nice and big. Okay, guys, I'll YouTube y'all very soon. Okay, take care. Bye.